Who's a fan of healthcare reform? I got one left. It's going to be valuable someday. Who's a fan of healthcare reform?
My name is Sheila Cook, and I came out here today because Obama is not my doctor. And I don't want a committee deciding when I die, where I die, or how I die. I want to decide it for myself.
At town hall meetings across America this summer, the cameras focused in on the raw emotions of the healthcare debate. One subject of increasing attention is how the proposed reforms will affect seniors' ability to access quality care. Plans to reduce spending on Medicare and pay for end-of-life counseling are interpreted as death sentences for seniors by some.
Being a senior citizen, I'm afraid about rationing. I don't think there should be rationing of any kind.
We're both at that age where our life is on the line.
Some conservative commentators have stoked these fears about how seniors' health care will suffer if reform is passed.
I mean, what do you make of this backlash on these town hall meetings?
Oh, I love it. I love it.
Dick Morris is a veteran political consultant and one of the most vocal opponents of reform. He argues that if enough seniors oppose the legislation, it will die.
The key thing for the Republican Party to project is that this is the end of Medicare, is the repeal of Medicare, is the repeal of Medicare. That's all it is. It's going to kill our parents, literally.
Is Obama's plan going to help me?
No. Obama's plan is going to kill you. Look, there's a fundamental fact here. A quarter of all Medicare money is spent in the last year of a patient's life.
Right.
They can't say we want those people to die, but that's what they mean.
Morris made his name as Bill Clinton's chief strategist during the 1996 presidential election. He was credited with moving Clinton towards the center by incorporating Republican ideas like deregulation and balanced budgets into his message. But his career derailed at its peak when tabloids reported an affair Morris was having with a prostitute. Morris worked to reinvent himself as a commentator and a critic. He wrote popular books lambasting the Clintons and other liberal figures, including President Obama. Today, Morris writes columns in the New York Post and the Hill newspapers, where he's turned attention to a movement of seniors against healthcare reform. But Morris is also the chief strategist for an anti-reform group called the League of American Voters. The group is building momentum for the very movement that Morris is reporting on. On his own website, Morris solicits donations to have this television ad shown in key swing states across America. Dick Morris wrote the ad for the League of American Voters.
How can Obama's plan cover 50 million new patients without any new doctors? It can't. It will hurt our seniors. End Medicare as we know it. Ration coverage and care. Limit life-saving medicines. Impose long delays on cancer treatment and other vital surgery. It's happening in England and in Canada. Don't let it happen here.
This ad has reached millions through TV and the internet, and many of Morris's political columns mimic the claims in his ad. In a recent column for The Hill, Morris writes, "Higher demand without extra supply will mean rationing, which will take its greatest toll on the elderly, forcing them to forego elective surgery or do without life-prolonging treatment." Until this week, the newspaper identified Morris as a former political consultant with no mention of his work with the League of American Voters. Then, the Huff Fund contacted The Hill, and the next day, the paper began disclosing Morris's activist work in his bio. However Dick Morris has affected the healthcare debate, it's clear that one of his goals has been accomplished. A growing number of seniors are suspicious of reform. A poll by the Kaiser Family Foundation found that the number of seniors who believed they would be worse off with reform jumped by 7% in just 1 month this summer. By September, when conservative groups flooded Capitol Hill to protest reform, senior citizens showed up in force.
I've taken good care of myself all my life, and to reach a point in life where at some point I'm going to be told I'm expendable, no, that doesn't work for me.
I feel very vulnerable. And at my age, I can't afford vulnerability.
And their emotion is understandable. Somebody is trying to take away their health care. These are the same guys you had in the 60s. They're just 70 now.